Aloha, good morning, everyone. Aloha kakahiaka. Thank you so much for joining us this morning. I'm going to go ahead and orient us to today's webinar. Mahalo and thanks everyone for being here for our internal webinar series, Enlivening a Culture of Health. I want to warmly welcome everyone today to the 8th episode of our series. And we're going to start this morning in a traditional Hawaiian way that we come together as a community in Lōkahi, if you will. And we're going to start with Pinky's Pule. In our practices, usually when we come together as a group, as a hui, as a team, and a committee, we'll say these words together and we'll say them aloud. So we won't be able to hear you today, but you're going to actually hear us. So we just invite you for a minute, put down that email, put down your pen and paper, and join us from the office, join us from the home, wherever you might be at. And please, let's think of Uncle Pinky, and then we'll say the words together within the pule. So Lisa, Auntie Kim, and Sarah, I'll invite you to unmute now and Kahi, Lua, Kolu.
Let us call forth the supreme powers of our individual spiritual beliefs to join us. For those who have them, call forth our Aumakua, our guardian angels, to be with us today. And now reach inside ourselves and touch the spirits of our family members and special friends who have assisted us. To be people who care, who want to share, and dare to achieve impossible dreams. Let us gather our spiritual strength so that we can aloha them. Thank them for their continued encouragement, guidance, and protection. As we proceed through life, now for our supreme powers blessing upon this gathering, in the words of our kupuna, in their language of comfort, Nakia kua e ho'opomaika ia opo, aloha apumehana.
Mahalo, everyone. And sometimes it sounds like a chorus, right? And that's always what happens when we gather, when we launapu, when we ho'olauna, when we come together. It's really beautiful, the cadence of our voices when we bring the spirit of our ancestors together. So thank you, everyone, for joining us together with Pinky's Pule. Our esteemed panel today helps us to continue part 2 of the series continuation. And we're really excited to welcome these 3 experts, Native Hawaiian wahine from Papa Ola Lōkahi. Their dedication and their commitment to improve the health status and well-being of Native Hawaiians and others includes advocating for, initiating, and maintaining culturally appropriate strategic actions at improving physical, mental, and spiritual health of Native Hawaiians, their ohana, and empowering Native Hawaiians to determine their own destiny. During this webinar, we're going to learn from the 3 of them. We're going to hear about Papa Ola Lōkahi's kuleana, the Native Hawaiian Healthcare Improvement Act, the Native Hawaiian Healthcare Systems, and the Native Hawaiian Scholarship Program, some of the other workforce development activities they have in place, some of their programs, services, and partnerships. We've been partnering with Papa Ola Lōkahi for several years now in multiple different capacities through Nalima Hana Olonopuha, the Native Hawaiian Health Consortium, through the NHPI3R team, which you're going to hear a little bit about, more about later. And then we have a multi-year agreement of understanding to work together to elevate the health of Native Hawaiians and to bring more culturally responsive care into our programs, services, and covered benefits at AlohaCare too. For those of you who may not know me yet or haven't worked with me, my name is Kealoha Fox, and I'm helping to lead this series and moderate today's session. At AlohaCare, we're really committed to the great diversity and the distinct cultural groups that intersect with our social determinants of health and allow us to better tailor our approach and understanding to the people that we serve and the mission that we carry out each and every day. At our organization, we believe that health quality is synonymous with health equity. And now is the best time for us to understand cultural and social determinants of health of our members, of our providers, and even our employees. So we've outlined a number of strategies included here, pictured in our Cultural Competency for Health Equity Plan. And this webinar is one part of that plan and program. We also have our Social Determinants of Health Strategy and Action Plan. These are our numerous pillars that we feel are intersecting and interconnected in the work that we do. And so today we're really excited to tailor episode 9 in our webinar towards our community and cultural strengthening pillar. We're going to hear from the team, and they're going to share some of the work that they do. First, I'm going to start us off with our poll. It's going to pop up on your screen. It's going to launch now, and go ahead and just interact a little bit with us virtually today. How many Native Hawaiian healthcare systems do you think that there are? While you're taking that poll, I'm really excited and want to warmly welcome Auntie Kim Ku'ulei-Bernie, Lisa Leilani Ka'anoi, and Sarah Kamakaviva Ole, all from Papa Ola Lōkahi, who we get to work with a lot. And we're really excited to have join with us virtually today via Zoom webinar. Auntie Kim Ku'ulei-Bernie has more than 25 years experience working in the public health arena with health departments and ministries across the U.S. and including the U.S. affiliated Pacific Islands. She engages in program management, advocacy for Native Hawaiians and Pacific Islanders. At Papa Ola Lōkahi, she leads communications and community engagement. For the past 2 years, she's been actually extremely instrumental in our communications and outreach efforts for the Native Hawaiian and Pacific Islander COVID response team. She serves on several boards and committees, local and national, and includes a lot of different public health topics of interest for many of us at AlohaCare. Her kule'iwi are Kohala, Nihiku, Lahaina, Lihue, and Manoa. Welcome, Auntie Kim Ku'ulei-Bernie. Lisa Leilani Ka'anoi is the engagement specialist at the Mauliola Malama Lama program at Papa. And this is the health workforce development department within their organization. She was born and raised in Alaska and received her master's in public health from the University of Hawaii at Manoa. Fun fact is Lisa began working with Papa in 2003 and then returned back again in 2019. And her favorite drink of a treat is a taro milk tea with purple rice from Kaukaus in Kaimuki. So welcome, Lisa. And Sarah Kamakaviva Ole, I get to work with actually a lot in the NHPI 3R response team in our policy committee. Sarah is instrumental and leads legislative and administrative policy and advocacy efforts for Papa, in addition to supporting a handful of Papa's staff and projects, both in Hawaii and across the US continent. Sarah's education prior to shifting into public health was in exercise physiology and research. I'm going to go ahead and in the poll now. You folks are going to hear more about the Native Hawaiian healthcare systems, Papa Ola Lōkahi's designation of them, and then some of our work actually that we're doing with the systems themselves. So welcome everyone. Auntie Kim, Lisa, and Sarah, at this time, I'm actually going to go ahead and turn it over to you folks. And you just let me know when you want me to advance the slide for you. I'm happy to help. Aloha.
Yeah. Aloha, mahalo nui ke aloha. Aloha to you, aloha to our friends on the call here, aloha to everybody who has tuned in. Greetings from our executive director, Dr. Sherry Daniels, and from our board of directors. And let me turn it over to my two colleagues to a moment, and then we'll start into the presentation.
Mahalo, Kim. Mahalo for having me, and welcome to everybody. And also, I'd like to send aloha from Donna Marie Palakiko, who I'm actually doing the presentation in her place. She's actually currently completing her Fulbright fellowship in Australia. So I'm honored to be here, and yeah, She sends her aloha to everyone.
Morning. Hi, everybody. This is Sarah. Thanks so much for allowing us to come and share about our work with you today.
And again, next slide, please. Mahalo nui. We all three work for Papa Ola Lōkahi. You've heard a little bit about us, our mission statement from Dr. Fox. We are going to tell you a little bit about what we do and what we're involved in, what we have done, what our plans are for moving forward. But I know it's really common for people to say, oh, Hawaiian health, it's so special because the statistics are so dire. And we don't really want to start out with that story. We start out with the story that traditionally we were an awesome, healthy people. We had very low incidence of disease. Our healing modalities were used mostly for prevention or for injuries, more injury than illness. We had high levels of and sophisticated society. We had healthy diets. We engaged in physical activity regularly, and we took great joy in fun, in play. And in fact, there is one quote from one of the sailors who sailed with Captain Cook in the initial voyage. And in his log, it says, the natives of these islands are, in general, above the middle size and well made. They walk very gracefully, they run nimbly, and are capable of bearing great fatigue. And there are other citations about how clear our skin, how pleasant is our countenance. And so we were a healthy people. We have a legacy of excellence in what would be the high arts. And I know you're familiar with some of these, from feather making to woodwork, fishing, agriculture, to sports and games, and our religious practices. We were awesome at natural resource management, fish ponds. Really, there are no similar fish ponds elsewhere in Polynesia. There are lo'i or terraces, patties, such as we have in other places, but we were excellent conservationists, using only what was needed and maintaining a constant and natural balance. Traditional healing, I touched on a moment ago. There are actually many different forms of healing. These are the three main modalities that are referred to the most. La'au lapa'au, which is plant medicine, either internally or externally. Lomi lomi is a healing touch, and ho'oponopono, which might address the situation, or it might simply clear the way for the situation to be then addressed through lomi lomi, la'au lapa'au, or perhaps Western medicine. What we do know is that over time, from contact, we went from a population of, depending on which source you cite, anywhere between 800,000 and perhaps over 1 million, according to Dr. David Stannard. We went from a population, we were wiped, more than 90% of our population was wiped out in the 19th century. And we'll show you a census slide a little bit later, but if you look to that, the graph on the left, the darkest one on the left, you see that the population declines quite rapidly. So what are the underlying causes of the situation now? Dr. Keikuni Blaisdell did some of the original research, and it's been, there are many academics who have gone into the research now. He cites five main causes: the depopulation and us becoming, Native Hawaiians becoming minority in our own homeland. The loss and degradation of our environment, the land, the waters, and the air due to colonialism. There's a cultural conflict between traditional Hawaiian knowledge, attitudes, beliefs, and practices, and ways that were introduced to Hawaii. There's a sense of despair and self-destruction when we no longer know what our traditional role is in this changing society in Hawaii. racism, both overt and institutional. The impacts on our health, specifically due to colonization, the introduction of foreign disease, the breakdown of our religious system that set up really a form of governance as to how we behave in situations. When the kapu system was subsumed, then people were at a loss and there was a sense of confusion. Dispossession of our own land, not that we ever owned it, but there was a sense of belonging to the land. A foreign system of government and a foreign system of economy, cash-based versus the trade and barter versus the ahupua system. And a very overt suppression of Hawaiian language, traditions, customs, and in fact, our values. So Dr. Blaisdell, who didn't like to be called Dr. Blaisdell, Kekuni really identified, he kind of compared Western values to traditional Kanaka Maoli or Native Hawaiian values, the individualist versus those that belong to the collective or to the ohana, a sense of capitalism, which America, is expert, really is America's expertise, versus a caring and sharing and a sense of reciprocity for the aina, the environment, which is in fact sacred. In the late 19th century, our ali'i, our Hawaiian royalty, observed these changes happening, and each one of them over time left a legacy. They took a special interest in the social welfare of their people, and today their legacies are in place. For health, Kamehameha IV and Queen Emma instituted now the Queen's Health System. It was the Queen's Hospital at that time. And Queen Kapi'olani, the wife of King Kalakaua, is the original founder of Kapi'olani Women's and Children's Medical Center. And then I think the legacies of these other areas in education, kupuna care, housing, civic engagement, children and families, which are all social determinants of our health and well-being. So a little bit of history. We'll go through just a couple of slides of history, and then I promise that I'll start talking a little bit faster. In the early 1980s, Congress commissioned a study, and this was at the urging of our congressional delegation at that time, to put together a report on what is the state of Native Hawaiians. And the majority report was issued, and that majority report, well, it was the report at that time, said Hawaiians are fine. There's no issues at all. But there were 3 members of that congressional commission who said, including Kina Upoid Kamali'i, who was a trustee, perhaps she was a legislator at that time, and then she became an OHA trustee. She said, I don't think so. And so 3 of them took another look at the data. They really connected it to Hawaiian knowledge and the belief systems there. And they said, well, actually, when we disaggregate and we look a little bit more closely at the data, Native Hawaiians do have some of the worst conditions across all social and economic areas. And that statement that you see there is the key finding right there. So thus, the Native Hawaiian Study Commission became known as, had a majority report and a minority report. And the minority report is that the state of Hawaiians is not so great after all. So following that commission study, the next slide, please. Then we get into the establishment of Aola Mau. The education was broken out. What was the situation in education? What was the situation when it came to other economic conditions? For health, the Aola Mau organization, the study was established first. So this is the earliest group that met at the Department of Health as part of the Aola Mau. And for 2 years, they looked at the health statistics. They teased them out of the overall statistics to see what was the situation. 6 separate volumes were published looking at the broad view of Native Hawaiian health. And On the next slide, we have some of the findings. Let me just, first the photos there. I'm so sorry, the photo there. If you look in the very front, the second from the left, that's Dr. Chiyomi Fukino, Hawaiian physician. She eventually became director of health under the Lingle administration. Many of these people are still active, still working in the Hawaiian health arena, if you will. And the cutaway is Kenny E.E. Brown. He was with Queen Emma Foundation at the time, and he was instrumental in providing the support to underwrite this work to really determine excuse me, what the situation was for Hawaiian health. Dr. Kekuni Blaisdell is not in this photo because he always took the photos. Next slide now, please. The findings from the Aola Mouse study, again, there were 6 volumes, but they really break out into healthcare was delayed because there were no services available, necessary services available, resulting in poor outcomes, that Native Hawaiians were less likely to participate in health screening, such as breast cancer screening or other preventive measures, again, resulting in poor outcomes once there was a diagnosis, and that there was a significant underrepresentation of Native Hawaiians across the healthcare professions. And in fact, in 1985, in 1975, we know that there were only 11 Native Hawaiian physicians in Hawaii and across the US. There were 5 graduates in 1975 from the medical school, and there continues to be an underrepresentation. And then of overarching finding in all areas was that culture, the link to culture impacted our health and well-being. And so we rarely break Hawaiian culture out separately. We do our very best to integrate it into everything we say and everything that we do. Next slide, please. Right, so in 1985, these were the leading causes of death: heart disease, cancer, stroke, diabetes, higher than, not only higher than the rest of the state, but for some areas, higher than the averages across the United States. So Native Hawaiian Healthcare Act was drafted, taken to Congress. Pinky Thompson, whose name you heard earlier. Pinky Thompson was a social worker and really a leader for our people. He believed in education. He believed in the Hawaiian child. He believed in strengthening Hawaiian families, and he took a strong role in getting the Native Hawaiian Education Act passed and the Native Hawaiian Healthcare Act passed. Initially introduced in 1986 to Congress, never passed. 1987, no success. Finally, 1988, moved into public law to raise the health status of Native Hawaiians to the highest possible level. And the law says that the United States is to provide the resources necessary to improve the health status of Native Hawaiians. The act was reauthorized as the Native Hawaiian Healthcare Improvement Act for 10 years, and then it was reauthorized again in the Affordable Care Act, also known as Obamacare. So what was created by this federal Native Hawaiian health programs? Three programs within, 5 Native Hawaiian healthcare systems. What was the number? How many people got the answer 5 correct? I'm sorry, I missed that.
It was a little bit more than the majority, so a lot of folks got it right this morning.
Excellent. All right. 5 Native Hawaiian healthcare systems that serve 7 islands. The Native Hawaiian Health Scholarship Program that addresses the workforce development, and Papa Ola Lōkahi. So today we're going to be telling you a little bit about all 3 of these different programs, starting with the Native Hawaiian healthcare systems, because that may be where most of the most folks at AlohaCare engage. Next slide, please. We're going to go through all 5 very quickly. Ho'olalahui on Hawaii is located on Kauai, but it also serves a population of Ni'ihau, particularly their Waimea offices. So what's unique about Ho'olalahui and most relevant to you folks, I think, is that it has a dual designation. It is both a Native Hawaiian health care system designated in 1988 or 89, but in the early 2000s, it got the designation as a federally qualified hunter. So it has that dual designation, dual funding stream, and 2 sets of mandates guiding the work that it does. All of 5 of the Native Hawaiian healthcare systems provide very similar programs. I am not going to tell you about what they all have in common, but I will try to tease out what is unique to each system. So Ho'ola has a dual designation. It also has a pharmacy on site. And the Hawaiian healing services are both services and classes and workshops. And I mentioned that because I know that this is kind of event to what AlohaCare is now covering for in the way of services and programs. Okay, Kauai next would be Oahu, I believe, and that's Keolamamo. Keolamamo has multiple locations simply because Oahu is large, and also Hawaiians aren't congregated in one area, but Ko'olaupoko, Ko'olauloa or Kahuku, Waianae, Nanakuli office, and they also have their primary care setting right here in Honolulu. Cool thing about Keolamamo, so Keolamamo has doubled its Lomi Lomi staff in the last month and a half because they see the value and that's where the need is. They also have a gym, and they usually have fitness trainers on staff with them. Molokai serves both the islands of Lanai and Molokai, including Kalaupapa. They have all the same services, most of the same services that the others provide. For quite a while, up until mid-pandemic, Napu'uwai also had a kupuna daycare system. And that was set up because Molokai kupuna had to go off island for their elderly years, and they couldn't, either their younger families were not on island, or they were, but they were working and there was nobody to take care of them. So Napu'uwai was innovative in that it set up a kupuna health program. There also is a gym there that serves the entire island. And they have school-based programs. The others aren't so much yet involved in school-based programs. On Maui, Hui no Keolapono has a lot of the same similar services, including Lomi Lomi practitioners on staff. What's really unique about Hui no Keolapono is their Simply Health Cafe. It's located right on the same campus as the healthcare system, Cameron Center in Wailuku. And it's open Monday through Friday, and it serves not only the patients and the staff of Hui no Keolapono, but people from Kahului and Wailuku come to have a healthy lunch or pick up food to take home for dinner from the Simply Healthy Cafe. Last but not least, on Hawaii Island, Hui Malama Ola na Oiwi, its biggest challenge, they provide really amazing services. Its biggest challenge is transportation, getting people to access services. So a lot of its enabling services are providing transportation to get patients into the group sessions or workshops they might sign up for, particularly to bring them into where the primary care and behavioral health care services are being provided. All of them have primary care. All of them have either direct behavioral health services or referrals. All of them, a couple of them have direct dental health services, but if the ones that don't have direct care have referrals to dental health care services. So today, 2015, the leading causes of death for Native Hawaiians in aggregate with Pacific Islanders, we're still looking at heart disease and stroke. We're still looking at cancer. Diabetes is still high, but death has been brought down quite a bit. The numbers remain high because there's better screening and prevention. When numbers go down, we chalk that up to education and prevention and early education. So what's the status? Where are Native Hawaiians these days? Well, as of the the 2010 and then this update in 2013 that you're looking at, we estimate that approximately 3/5 of all Native Hawaiians were in Hawaii and 2/5 were spread out across the other across the U.S. But we fully expect, now that the 2020 census has been completed, we fully expect that that will change and that we will find that there are more Hawaiians outside of Hawaii than there are here at home. So, Papa Ola Lōkahi, we now embrace the kauhale model, and that is, how do we all live and work together and interact, and we're all interdependent on one another's resources, knowledge, information, and we all help and support one another. So, Ike Hawaii are our healing traditions. We have Hale Ho'ona Awao, which is our learning institute. They're mostly involved in the health, specific health subject areas. I manage the communications and engagement corner. Sarah's with policy. We have research and data and a workforce development, and we work hand in hand, and we help to build the capacity and support the efforts of the 5 Native Hawaiian healthcare systems. I'm going to mention a little bit about traditional healing because this is unique to the Native Hawaiian Healthcare Improvement Act in that in our law, so our law was modeled after the American Indian Healthcare Act, which did not include traditional healing. And as happens, when you model after another, you always, you learn lessons and you refine and you improve. And the Native Hawaiian Healthcare Improvement Act includes the recognition of traditional Hawaiian healing practitioners and healing practices. And then that was turned into state statute as well. So this is some of the work that our elder Babette Galang is involved with. She does a lot of education with groups around the state, and she convenes kupuna councils. She actually has trained with these kupuna that are shown here. She learned la'au lapa'au from Papa Henry Awai, who's shown in the bottom, with his cousin Noah Emmett Awai Luli, who's a medical physician. Babette learned Lomi Lomi from Auntie Margaret Machado in the hat there, and Ho'oponopono from Auntie Malia Craver, who was long time at Queen Liliuokalani Children's Center. I'll turn this part over to Sarah.
So with all of the federal act mandates, there are some responsibilities that Papa has been included in the state legislature. So I would say, like, all of those that were not passed in the most recent year are listed here. And as Papa continues to grow and build relationships, I think we've seen an uptick in the number of mentions that we are in state resolutions, etc. And it's also part of our ongoing state legislative strategy now is we don't typically write bills. We support those who do. We support bills that are relevant to our kuleana here, to our kuleana, to Native Hawaiian health in general. But kind of these are one of our pockets of immediate priorities, is that we have mandates per our federal act. We have these standing kuleana. So what we do during state legislative sessions, which, I mean, it's no secret strategy, is when you already have standing kuleana, you have to be careful about trying to add to the plate. So a lot of this work, I think, is just a testament to all of the almost 35 years of POL's work and the different pieces that we want to support in alignment with our mission and with our federal mandates.
Mahalo, Sarah and Kim Ku'ulei. So the Hawaiian Health Workforce Development, this has actually grown over the last, I don't know how many years. It was originally just the Native Hawaiian Health Scholarship Program. As you can see, the logo on the bottom, the popola berries. So that was the logo that was gifted to the scholarship program. And then once we grew, ended up having more and more programs. we decided to turn it into a department. And Donna Marie Palakiko is actually the one that came up with the name Maoli Ola Lama Lama. And then one of our staff and a previous staff member actually came up with that logo, that circular logo. So basically our goal is to increase Native Hawaiians, Native Hawaiian health professionals, and also in allied health professions, and also to enhance the qualifications of these Native Hawaiians working with and next to other Native Hawaiians in their ohana. So far, just last year, we celebrated our 30th year. So we did have some, a 3-day symposium and brought back previous administration, previous scholars to kind of talk about how the last 30 years have been and where we're going now. So we've allocated approximately $25 million. As of, I think this year, we've awarded 324 scholarships across 20 professions. 70% are in primary care, 30% are in behavioral health and social services. And then the following 3 professions are where most of the awards went to. So nurse, physician, and social workers. And this is just a picture of our 21-22 cohort that are kind of, they're all going to school all over the place. So if you aren't aware of the scholarship program, you do not have to be residing in Hawaii to apply for the scholarship or to be eligible for it. So one of the new programs that developed is called Kako Ulu Ohana, and this is for those that are were not eligible for the scholarship program, and it's reimbursement based financial assistance. We don't call it a scholarship program, and so this is a smaller amount, and it's also actually we have 2 cycles a year. So we just had our first 2 pilot cycles. The first one we awarded 7 folks, and then the second cycle we awarded 11. So we're really excited about this one. So this picture, I think I will, because there's so those of you that know Dr. Momi Ka'anoi, she is my sister-in-law. And so that's how, because I'm famous, I'm associated to her. But actually, I'll have Kim talk more about all these faces here in this slide.
Right. We have over the years, right now, we really work hand in hand with the Department of Native Hawaiian Health and others who really cover the research part of Native Hawaiian Health. But in the past, when there wasn't a Department of Native Hawaiian Health, we had a really robust research arm at Papa Ola Lōkahi. And this is just one example of the more than 100 Native Hawaiian researchers that we have identified, trained, mentored, grown, encouraged publications over the year. Here's an example of, some of our favorite folks, but honestly, there are more than 100 Native Hawaiian researchers I would say many, many more than that. I'm just throwing out a big number now, but we, at one time, within my era here, you could count the number of Native Hawaiian researchers on 2 hands. And now we have many more. And this is something that Papa Ola Lōkahi was instrumental in. And then on the next slide, if we could, we don't have, this is a new area for us, the community health workers, but I'll point out a little bit of information provided by our colleague, Napua Casson Fisher. The Native Hawaiian and Pacific Islander Community Health Worker, or CHW Collaborative, is a group of community-based organizations and individual Native Hawaiian and Pacific Islanders serving community members focused on those communities through the work and efforts of CHWs and coming together to lift up and really help to improve the health status and efforts of Native Hawaiian Pacific Islander people throughout the communities. The collaborative has more than 50 members from the Native Hawaiian healthcare systems, from Native Hawaiian and Pacific Islander serving nonprofits, entities, organizations, and from the Department of Health's Team 6B. Papa Ola Lōkahi supports the CHW program through certificate training, certification training, providing tuition sponsorships, tutoring, study sessions, and curating internship sites for newly trained CHWs, including the Hawaiian serving community health centers, as well as our Native Hawaiian healthcare systems. And then next year, CHW program is going to reach even further back into the high school. Start looking at high school training. Another legacy that we have that is still relevant and active is we have developed tons of culturally, that's a scientific figure, health education materials, particularly in cancer and diabetes. You'll find that on our imihale.org website is still active. That's a Native Hawaiian Cancer Network. Some of these materials are still there and being updated. We also have curriculum and health education materials on the next slide. The Pacific Diabetes Education Program .org is still active. And again, that has curricula as well as resources for diabetes, stroke, and heart disease. And we are updating those brochures and stroke as we speak. So this is just like a bullet list of some of the things that we're currently involved in, and you'll have a chance to see this later, but we kind of reach across and we partner with government and private entity to better serve our communities. We're really strong in the history of Hawaiian health and medicine. We put out the timeline. We really served as a resource when during the pandemic, when folks were looking into our history to see what had been done in the 19th century when smallpox and influenza and cholera and the Spanish flu came to Hawaii. We already had that baseline data, and so we were really proud to be able to serve as a resource. And right now, for the last year and a half, we have had 2 archive assistants on staff, and they've been scanning documents, particularly the papers. I have more than 20 boxes from the Dr. Kekuni Blaisdell's family, and we're scanning those. And by next year, we hope to go online with the Native Hawaiian Health Archive. Next, please. Because I really will talk really fast. Kealoha mentioned this already. We have 2 programs that we've responded to COVID-19. The NHPI 3R team, which is described right here, was developed really early on. To this day, we still have 5 working committees, and we are looking at COVID is still here, but as we look at the recovery and the resiliency phases, what COVID really did is it pulled the curtain back on the health disparities that existed already. We knew that being in the field, but now more people know that as well. So how do we take this really amazing collaboration that we've developed through the NHPI 3R and use it to address some of the other issues in order to achieve equity among our communities, prioritizing Native Hawaiians and Pacific Islanders? We've got our own website. We've got a weekly bulletin. We've put out data specific to Native Hawaiians and Pacific Islanders every week, and all of you are invited to. Actually, AlohaCare does participate. Mahalo nui to everybody who has. And next slide will describe our second program. When last year, the federal administration passed the American Rescue Plan Act, or ARPA, providing $1.9 trillion across the country in COVID-19 relief. 6.1 billion came to Hawaii for a variety of purposes. 50 million went to the community health centers, and 20 million went to Native Hawaiian healthcare. Papa Ola Lōkahi received that money, and what we're doing over a 2-year period is we are flipping it back out to 20 different organizations and agencies with proven track records of providing services and programs to really help with the recovery of our communities, especially those, who sustained really hard times during the pandemic. That's called Namakovai. We have our own landing page on our website, and that's the link to it. Sarah.
We did get asked to talk a little bit about policy. There are lots and lots of things going on. If anybody's been checking in, the Inflation Reduction Act did a votorama that took until about 9 in the morning the following day. Lots is going on, at least on a federal level. The equity efforts from the Biden administration and the Democratic trifecta in general have been really friendly towards Native Hawaiians in a variety of legislative and administrative way. We don't talk about the judiciary right now because it's a little bit of a mess, but all that just to say, lots going on in the policy world. And as I'm sure many people on this call can relate to, there's so much going on administratively. Lots of headlines drop about Congress all the time. Little is really said about the administrative side of policy and advocacy that Papa and many other entities engage with, both in the state and federal arenas. So at least as far as we can see in the federal arena, it's been really friendly. We're hoping that that friendliness can carry over into the appropriations into 2023. And we we're really just seeing kind of the writing on the wall in terms of this election season and looking to shift strategies back into a little more defense and retention mode like we did during the last administration.
We're very forward looking as well. Next year, we'll be celebrating our 35th anniversary. We will be convening a Native Hawaiian Health and Wellness Summit, which will include research and workforce development and traditional healing and a multitude of topics, which it's still in planning. I already talked a little bit about CHW worker training expanding to the high school level and the archive. We've been scanning for 2 years. We're hoping to have it in a content management system by next year. And Aola Mau, which Becky has shared a little bit about to our original reports on the Papa Ola Lōkahi's website. We will be updating that next year as well. And this is just a small summary of some of the things of our history and some of the things we've been involved in. And any of us, on behalf of our executive director, Dr. Sherry Daniels, any of us here or on our staff would be happy to answer any questions you have. Reach out to us. Our website is papaolalōkahi.org. And, we've got all of the conventional communications channels that you folks are familiar with too. Mahalo nui.
Mahalo. If anyone has any questions, feel free to insert those into the chat or the Q&A for us while we have Auntie Kim, Lisa, and Sarah on. Thank you so much for covering just such a wide array of the kauhale work that you folks are doing. It's really impressive the way that you're able to weave all of this together, and it really creates a sense of Lōkahi in the way in which you view the improvement of Native Hawaiian health and the potential that we can achieve. And I think one of the questions we had is, we know what the barriers are. We know what the barriers have been, what they are now, and what they will continue to be if there aren't solutions. And I think we would love to just hear from each of you. What solutions do you feel like are really helpful that you are connected with through your work, whether that's workforce related, disease specific, or some of the social and collaborative aspects of the way you folks. I'll start first, maybe with Sarah.
Wow. Solutions. I really think as it pertains to Hawaiians and we really have all of the solutions that we need. I think looking into our ancestral knowledge, our practices, our culture, it's not really about finding something, in my opinion, as much as reconnecting to what our people already knew for a really long time, and bringing that to the forefront and trying to imagine how that exists in the current systems and structures that we're in now.
And Lisa, how about you, from your vantage point in the great programs that you're supporting, and you're actually supporting individuals and professions and whole sectors? Like what are some of the solutions that you see that are helping?
Well, we really wanted to, so the scholarship program is for eligible professions only. So we realized there was a need to go beyond that and expand our support to frontline workers. So the ohana program was for those that were not your typical health disciplines, right? So, you know, those that are still going to school and trying to make an effort to make the lahui better, we didn't want to leave anybody behind. So it's kind of trying to find creative ways to get more inclusive on, you know, getting more Native Hawaiians to help Native Hawaiians by Native Hawaiians.
So important, especially for us. We do have an extensive provider network, and so we're always wanting to make sure that we're tapping into people that directly live and work in the communities that they're coming from, and they have a layer of knowledge that's really important for health quality and healthcare access and cultural responsivity that we know doesn't exist if we, you know, continue to have health professions separated from the community, the residents, and kama'aina. We think that that's really important too. And Auntie Kim, what are some of the solutions that you feel like are critical for us to eliminate these barriers, and you want to see us continue moving forward with as we look to 35 years and beyond?
Right. That is exactly what the question here in the Cute by Pat. So I think what I visualize is in the future is a community, island people who are connected to one another, who have relationships, strong relationships to community, who are informed, who are better connected to our land, you know, that we're a little bit less reliant on external forces and external imports and more self-reliant here, that we are better informed about our traditions, our wise practices, the wisdom of those traditions and wise practices, and how they play into things such as diet, our physical activity, our stages of life, you know, our life cycle practices from, you know, caring for keiki, hapai, giving birth, working with our kupuna, that there's wisdom in that we are developing programs and relationships really, and how we engage with one another. I think not to step on the really good and innovative folks at Ho'olu'aina, but where well-being is founded on relationships. And I think that also for us includes relationship to the land, relationship to one another, relationship to our higher spirit or power, whatever that is. I think that's where we need to be in the future, and we need to work on those family strengthening programs. You know, through aha wahine, aha kane, aha ohana, all of those things, which sometimes seem a little bit fluffy, but it's about strengthening our relationships so that then we can trust one another and support one another to engage in healthy practices.
Oh, and Sarah, there's one more question for you. I mean, you've done so much with the legislative work, and I see you wrote a really beautiful answer into the chat, but can you just share your answer on some priorities and topics that you think are going to come up for folks that aren't able to see the Q&A response that you put in?
So actually the kind of dominant looming thing for me in the background is about the implementation of the record amount of funding for Native Hawaiian initiatives that passed the legislature this year. We already know some of those fundings have stipulations, have spend down years, et cetera, et cetera. It doesn't help that it's an election year. So a new administration that might be rising, you know, kind of has that transition period that's going to just simply take time. But I think on all fronts. If there are not promising foundations in implementation of this year's funding, next session is going to be a hard battle, no matter what industry or topic area. Regarding topic areas, I think some of the same things that have been cresting for the last couple sessions, affordable housing and lowering houselessness in general is always of concern. It's a social determinant of health. It's an area in which Native Hawaiians and Pacific Islanders are overrepresented. In reimagining tourism, that's been in the news a lot, but also just because of the fractionalization of how many Hawaiians are employed in hospitality or food and bev, that is going to be something that really affects community a lot, I think. And kind of in lockstep with what's happening on the federal arena, health equity initiatives are kind of, for the thousandth time, new and fun and sexy. And so the way that those initiatives and programs and areas are being thought out and implemented, and whether or not I think they're true to equity, I think I'll leave that as an open door. But there is a lot of funding to be had. There's, like I said, a really strong support from the Biden administration regarding equity. So to see how that plays out on the state level, I think will be real interesting.
Yeah, mahalo nui. That's a great way for us to have today's webinar and look forward not just to the 2023 legislative session, but also the 2023 Native Hawaiian Health Summit and all of the work that we'll continue to do, I know, for years and generations to come, since I've known each of you for quite a long time. Auntie Kim, the longest, since as we wrap today's webinar, AlohaCare, we just really want to mahalo our relationship and partnership with Papa Ola Lōkahi. We want to mahalo Auntie Kim, Lisa, and Sarah for your time, the expertise you've shared, and just the generous work that you're doing on behalf of the community. It's not always the easiest work that any of us do in healthcare, in the health sector, in health professions, but you folks really give us a lot of energy and inspiration from the PSAs that we see and the news stories that we read and the collaborations that you've shared throughout today's webinar. I thank AlohaCare's leadership team for supporting this ongoing initiative, and mahalo each of you for starting your day with us. We know that a healthier and equitable Hawaii is possible by us working together in partnership, by truly embodying the value of Lōkahi. We can unite together to address these barriers and reinvest in these time-old traditions and solutions that are specific to Hawaii's legacy, and that can cross education and transportation and economics and the environment and housing if we each work together. If you have any questions, please continue to reach out to me. Feel free to connect with our episodes. This is episode 9. The rest of our episodes are on AlohaCare Hawaii's YouTube channel page and are streamed for your educational purposes. Again, thank you everyone so much for joining us today. Please stay safe.